In this chapter, we're going to look at requirements in the medical record in regard to what has to be in there, how long do we have to keep the information, how long do we have to put the information in the record. Now, first we have to identify what records have to be kept. Through law, accreditation standards, federal law, state law, there are mandates that healthcare providers have to maintain on every patient. Doesn't matter if it's inpatient or outpatient, but there has to be a record kept on everyone. And as I said, this is required not only by state laws, but also federal laws. We have accreditation standards if we're an accredited institution. One of the most common, as we've said before, is the Joint Commission, and also conditions of participation, Medicare, Medicaid conditions of participation. There are four basic types of data that you'll find in a health record, and we've covered this in HIT 151, your beginning class. The first type is personal data. So in a health record, you'll find the name, date of birth, sex, next of kin, that information that's personal to that particular patient and helps identify that patient. There's also financial data found in health records, usually name of employer, and the reason that's important because a lot of times it goes back to the health care coverage, health insurance coverage information. You may see the type of coverage, policy numbers, identification numbers for the particular patient or individual. And a lot of this personal information and financial information, you'll find it, if you'll remember, on the face sheet, on the top part of the face sheet. There's social data, such as race, the patient's family history, which is very pertinent, very important in regard to some diseases run in families. They'll get a family history. Lifestyle is part of that social data, or personal history, and that's important. Exercise, diet, history of any type of maybe drug abuse, tobacco use, those types of things. And also history of the patient's medical diseases or any diagnoses, so the patient's medical history. And that's part of the social data. Some of that you will find on the face sheet. Others, such as family history, personal history, lifestyle, you're going to find that in the history and physical. And then the biggest part of the record, the most information, the most data kept, is the medical data or the clinical data on the patient. This is continuously maintained, and it gives a history of treatment provided to the patient. When I say history, meaning everything that's happened to the patient during that particular encounter. We have the chief complaint, the history and physical, plan for treatment from the physicians. The nurses also have a treatment plan on the patient, all the diagnoses, the orders, the progress notes, not only from the doctors but also any other healthcare providers that give care to the patient, usually have progress notes in the medical record. The patient has surgery, op reports, path reports, the testing such as lab and x-ray, all of that is considered medical data in the record. And then at the bottom it talks about evidence and of informed consent. We're going to talk about consent, and we're going to define informed consent versus not being informed in regard to consent. And we'll define that, but the evidence that the consent was informed is usually on a form that the patient signs. That's not the informed consent itself. There's a process of telling the patient about, for example, a procedure. What is the procedure? Who's going to do it? What are the risks? What are the benefits? What are the alternatives? And so that is actually the informed consent, but the evidence of it is usually a consent form that is signed by the patient. Now, when the record is being compiled, it can be handwritten, it can be typed, or it can be computer generated, or it can be a combination of all. And as you know, we're moving into the electronic health record era, but in the past and also in the present, many medical records are still on paper, they're still handwritten, but some of the documents within the record are commonly typed. For example, if the progress notes are handwritten, the doctor's orders are handwritten, you'll usually see the H&P, discharge summary, op report, path report. Those types of reports are usually typed. They're usually dictated by the physician and then transcribed. And the reason behind this is because of legibility. These particular reports are those that are usually referred to the most and are sent out if we have a release of information request. We usually don't copy the whole record and send it. We'll send pertinent parts of the record. And again, that's usually discharge summary, H&P, op report, maybe consultations, and path reports. That's usually what's sent out with a medical record. Sometimes lab results, and those are usually computer generated now, but they can be handwritten and they can be typed. But the computer generated record, of course, it will enhance the completeness and accuracy of the information and enhances the availability to users. We've mentioned this before. You have a paper record. Only one person can access that paper record at a time. But with computerization, then many people can have access to a patient's record at the same time. Now, why is it so important that health records are accurate and complete? Now, some of this is just obvious. It's used to document, and it mentions chronologically, so in time order, the care that was given the patient. So it is the proof of what was done for the patient. But it's also used in other ways, such as to plan treatment or to evaluate treatment that's already been given. It's a very important communication tool between the health givers. So it lets everybody know what's going on, what has been done, what the patient's progress is, and when I refer to everybody, I mean those people that are providing treatment and care to the patient. So it's a communication tool. It's also used for research, for utilization management and peer review. Now, utilization management, a lot of times you'll hear utilization review. That may be new to you, but that is usually the UR department. Utilization review is that department that makes sure that the patient needs to be in the hospital and deals with payers, third-party payers, insurance companies to have the stays certified, to determine how many days the patient can stay in the hospital, those types of things. And then with peer review, there are committees, and peers will review treatment that was given in regard to the quality. And when we say peer review, a peer is an equal, so it means physicians reviewing other physicians' work and to make sure that it's of a quality nature. If it was nursing, that would be nurse to nurse. So peer review is always on the same level. But the record, in addition to documenting the care given the patient, it has many, many uses. In regard to it being a legal document, and I've said this before, the medical record is a legal document, and it is used to provide evidence in case there's a professional negligence suit, which is known as malpractice. That is the definition of malpractice, as professional negligence. It can be in regard to health treatment. There can be legal malpractice with a lawyer, so it's on a professional level. Any of us can be negligent. meaning we don't do what a normal person would do under the same circumstances. And so professional negligence is just given another name, and it's called malpractice. And if a malpractice action is brought by a patient, then that medical records it can serve as evidence of what actually happened to the patient and the care that they were given. Now, when there's a malpractice case, many times these are litigated, or they go to court years after the incident, the treatment was rendered. So the record is the only detailed, or the medical record is the only detailed record of what actually occurred. So it is proof for the patient and also for the healthcare providers of what actually happened. So that's why it's so important that records be created properly, because they enable the provider or the facility to reconstruct exactly what happened in that patient's course of treatment and to show whether that care that was provided was acceptable under the circumstances. Now let's look at content requirements. The requirements in regard to what must be contained in the medical record can be found in state and federal laws, statutes, those written laws, and also regulations of administrative agencies. Prime example of an administrative agency is CMS with the federal government. We have accreditation standards, and I put a note here to remember the healthcare facility has to meet those accreditation standards if they choose to be accredited by a particular accrediting agency. Again, the most known is the Joint Commission, but in other areas, such as rehab facility, there's CARF, C-A-R-F, Commission on Accreditation of Rehab Facilities. There are different accrediting agencies. The Joint Commission is probably the most well-known and the most prevalent, but always remember, if it's state and federal law, you have to do it. Accrediting is voluntary, but if the facility chooses to be accredited, then it has to meet those accreditation standards. Now, exactly what has to be on a medical record will vary from state to state. So we said there are state laws that govern what has to be on a record, but not all state laws are identical. So if you travel from one state to the next, the law will differ in regard to what exactly has to be on a medical record. And some states are very specific as to the content of the record. It has to have this and this and this and this, while others will be very broad and very general, that the record has to reflect the care given to the patient and the patient's condition when they came in and when they left. Your book gives some really good examples of the different laws in different states in regard to content of the record. Now, in the state of Alabama, the State Board of Health, which is the organization that licenses healthcare facilities, it mandates minimum content requirements for hospital records. And so in order to find out in the state of Alabama in a hospital what has to be in a record, we would go, the State Board of Health publishes what has to be in the record, and we have to be licensed as a facility to be able to open the doors and treat patients. So we must, in the state of Alabama, do what the State Board of Health says. Now, I'm going to, at a later time, show you. Used to, we just had paper copies, but now you can go online to the State Board of Health's website and look up they call them the rules, but it's basically the law in regard to what has to be on a health record, and there are different types of facilities listed. For example, hospitals, end-stage renal disease facilities, hospices, those types of things. So the state breaks it down by the type of facility or the type of care given. But I will show you that in at a later time in regard to these specific laws in the state of Alabama. Now, just an example, and as I said, the book has really good examples. Hawaii's regulations for medical record content are very broad and state that the medical record shall clearly and accurately document a patient's identity, the diagnosis of the patient's illness, treatment, orders by the medical staff, observations, and conclusions concerning the patient. Now, even though that's very broad and doesn't say, okay, you have to have this report and this report and this report, it is basically specific as to you have to identify the patient, say what's wrong with the patient, how it was treated, any type of orders that were given by the physician, observations on the patient, conclusions concerning the patient. So it covers a lot. It's just not specific as to the types of reports. But that pretty much covers everything about the patient if you look at it, but very, very broad. And that's just an example. Now, the CMS, Centers for Medicare and Medicaid Services, formerly known as HCFA, if you hear that term, we've talked about that before, right before it became the Centers for Medicare and Medicaid Services, it was HCFA, the Healthcare Financing Administration. Those regulations, which are known as the conditions of participation, and this should be reviewed because we did cover this in 151, HCFA, or again, CMS, imposes specific content requirements. And the conditions of participation for hospitals state that all records must contain the following. Now, if you look down through this list, and again, this is listed in your textbook, what the conditions of participation say must be on a record. There has to be an H&P on the record within 24 hours. Now, I think in some books you will see they haven't changed that. It says 48 hours. You need to correct that in your textbook. It is 24 hours now. There has to be an admitting diagnosis. There has to be results of any consultations, documentation of any complications, hospital infections that were acquired, any unfavorable reactions to drugs or anesthesia. There has to be informed consent for all procedures and treatments. There have to be orders, nurses' notes, reports of treatment, medication records, lab and x-ray reports, vital signs, and any other necessary information to monitor the patient's condition. On discharge, there has to be a discharge summary, and it has to have specific things with outcome of hospitalization, the disposition of the patient, where did the patient go after he or she left the hospital, and also if there's going to be any follow-up. Also, there has to be a final diagnosis or diagnoses with completion of the medical record within 30 days. And so 24 hours after admission, you have to have an H&P on the chart. Within 30 days, the whole record has to be complete, including that discharge summary. And so that's what the conditions of participation. And remember, conditions of participation have to be followed if a hospital treats Medicare patients. They have to meet the conditions of participation. Now, associations that accredit various healthcare organizations, just like I talked about just a minute ago, such as the Joint Commission. And when I say that, always remember there's more than one association that is an accreditation body, but Joint Commission is just the most common, especially in hospitals. They'll have standards that require specific content of the record. So if you work in a facility that takes Medicare patients and is Joint Commission accredited, you have to look at both of those types of standards to see what has to be on the record. I will say that over the years, the Medicare standards regarding record content and Joint Commission standards, even though they're not identical, they're pretty much matched up now. Remember a second ago, and we covered this previously, when I said change that 48 hours to 24 hours. In the past, Medicare said there had to be an H&P on the chart within 48 hours of admission, and Joint Commission has always been within 24 hours. And so that's just an example that Medicare changed their standards and they're more in line with Joint Commission. So both of them are within 24 hours of admission now. Now, whether or not there are specific statutory or written laws or regulatory from these administrative agencies, the guidelines, whether they apply or not, hospitals and other healthcare facilities have to have or need to have formal written policies that detail exactly what must be included in the record. And so if I go to the policy and procedure manual in a facility, there should be a policy on what constitutes a medical record, what has to be in a medical record. And there should be a policy that says there will be a medical record maintained, initiated and maintained on every patient treated at this facility. It will contain, and it should be listed out. Now, when these policies are at first developed, we need to go back and see what the state law says, what the federal laws say, the conditions of participation, if we're Joint Commission, what those standards say, and include all of that in our specific written policies that detail exactly what has to be on the medical record. And of course, that content will vary depending on the type of record, whether it's an ambulatory surgery record or an inpatient record or a clinic record. It just depends on, so we can differentiate. So it will depend on the type of record. Right, let's look at record retention requirements, or in other words, how long do we have to keep medical records? There are several things that we have to consider when we develop policies in regard to how long medical records will be kept. And again, those are other policies that need to be on the books. How long are we going to keep these records? In what form are we going to keep these records? When can they be destroyed, and how will they be destroyed? But when we're coming up, when the facility is coming up with the policies, the facility has to take into account, again, state and federal laws and regulations. Another thing that has to be looked at, statute of limitation for lawsuits to be filed. This will vary from state to state. In one state, a patient may have 2 years to bring a lawsuit in regard to malpractice. In another state, they may have 10 years. A minor may have until they reach adulthood plus 2 years. It just depends on the state, so we need to take that in consideration. How much research is done at the facility? Is it a teaching hospital? How much storage do we have? Cost of microfilming or computerization or long-term storage of records. And then we can look at recommendations. They're not laws, but recommendations of specific healthcare associations such as AHIMA, the American Hospital Association. They have recommendations on many things, including retention of health records. So we look at all of this. At a minimum, we have to abide by the state and federal laws and regulations. But after that, we'll look at other things. And so we may keep them longer than we're required by law to keep them, because if we may be a teaching hospital that needs these records, or we're a research facility, or we have plenty of storage, so we'll keep them for a long, long time. And so we look at all of these things. Now, the first that was mentioned is statutory and regulatory concerns. So laws and regulations. Now, the conditions of participation are specific, and they require hospitals to retain original records or legally reproduced form of a record for at least 5 years. So Medicare says 5 years you have to keep a record. Now, this means that the record can be kept in its original form. For example, if it's paper, we can keep it in the paper form, or we may take it from the paper and put it on microfilm, or from the paper and computerize it, or it may have been computerized to start with, but it has to be kept for at least 5 years. In Alabama, the law states that the hospital medical records must be retained for 5 years also. So they're more in line now with those conditions of participation. It used to be we had to keep records for at least 22 years. We were one of the states that had the longest retention schedule in regard to medical records. So by law, hospital records had to be kept for 22 years in the state of Alabama, but then that law was changed to 5 years. Now, AHIMA has those published guidelines on many topics, but in regard to retention of hospital records, patient health records, it recommends at least 10 years to keep the records. That's not the law. We don't have to go by that, but that is the recommendation that we'll take into consideration, is 10 years. As I mentioned, if we're dealing with state law, the laws are going to be different from state to state. And so those retention laws will vary from state to state. In some laws, there aren't any, in some states, there aren't any laws. They don't even say how long a record has to be kept. But the hospital is, or the medical practices, the different types of healthcare facilities, it doesn't mean because there's no law on the books that they're just going to go chunk all the records the next day after the patient leaves, because there are specific reasons for keeping these records. And so if there's no law, then they're not bound by that state law. Now, if there's no law and they're Medicare approved and they treat Medicare patients, they have to meet those conditions of participation, which say you have to keep them for 5 years. Now, there are some states that'll have different record retention requirements for records of minors and deceased patients. Sometimes with deceased patients, we can get rid of those records sooner because they're not going to be needed for continuity of care or for, different uses. Maybe if it's at a research facility, they may use them longer. Many times there will be exceptions to the law for minors, and it will say, as I mentioned a minute ago, till they become adults. That's called the age of majority, and then they'll usually add about 2 years on to that. That's not the case in the state of Alabama, but some states do have a different law in regard to minors. And when we go over the Alabama Law Manual and the specific Alabama laws, and that will be in the last learning module, we're going to talk about these specifics in regard to the state of Alabama and what do they say about minors and things like that. So we're going to talk about all of that. Statute of limitations. A statute of limitations is the period of time in which an individual has the right to bring a lawsuit. Now, you'll notice in this definition it said it's a period of time measured in years by statute or written law. It says, okay, if it's a malpractice suit, you have 2 years from the date of the occurrence in which to bring a lawsuit. If you wait longer than that, you're out of luck. The statute of limitations has expired. And so that's what statute of limitations is. Also, that time period or that statute of limitation may vary depending on the type of action. If it's a contract, and we talked about contract law and tort and things like that, but there may be different time limits in regard to the type of actions. So tort, injury, which would be a malpractice suit, may differ from contract law or real estate. So we have to know those statute of limitations. Now, mentioned a minute ago, another thing we'll consider after we've considered how long we have to keep records by law is how much space do we have. And that's always an issue with health information. It's where are we going to put all this stuff, especially with paper records. And so if we have a lot of space, we may just keep them for a long, long time. If space is not there and not available and we have to go rent space, then it's going to cost us a lot of money. Or another option is to microfilm records or computerize them where little space is required. And so after we've done this, even if we could destroy records, and we don't have to have them anymore after 5 years, but after 3 years, our policy says that we will put records on microfilm. It costs so much and takes up so little space that we're not going to go at the 5-year mark and then just burn the microfilm. We usually keep that forever and ever. And as I've said, when we go into this age of computerized records and everything's getting more sophisticated, when you go into a facility, it hasn't always been like that. Even if they're cutting edge now, at one time they had paper records and they probably microfilmed. And so you'll still have to go back and access old records on a microfilm system. And so that's why we teach you about it and we tell you about it, because it's still there, even if the facility has progressed to all electronic records. At one time, they were not electronic. They were microfilm. And so you'll see that even though they could be destroyed, we'll just keep them forever and ever because we paid a lot of money to get those records on microfilm, and they don't take up much space. Also, so we looked at medical research and storage space. If the facility engages in medical research, it may want to retain records for a longer period of time. Now, there are two types of research. A facility can do research. Healthcare providers can do research by gathering data from records, looking at what happened before, so old records or current records. Then other facilities actually are experimental research facilities, and they may do experimental research on patients. Now, if this is done, it is recommended that these records be kept for a long period of time. And the book will give you an example of at least 75 years. So if you are at a facility that does research on patients through experimental treatment, then those records are going to be around for a long, long time. I've already mentioned the availability of storage. If space is available, we may keep paper records for a longer period of time if we have paper. If space is limited, the facility can microfilm and computerize the records for storage. And again, if we go to that trouble, we usually are not going to throw them away. Now let's talk specifically about microfilming, because as I said, it still goes on, or at least you will be exposed to those records that have been microfilmed in the past. If a facility microfilms records, it can do it itself, or it can contract with a company to microfilm the records. And if there's an outside agency used, there has to be a written legal agreement in regard to how those records are going to be transferred from the facility to the outside company. What's going to happen to them? Are they going to be put on rolls or microfiche or jackets? The demands for quality, how is the quality control going to be done? Also cost, that needs to be addressed. We need to have a time limit. So if you leave here with these records, they need to be on microfilm and back to us within this amount of time. There needs to be in that written agreement safeguards in regard to this confidentiality and keeping these records safe when they're out of our hands. Availability of records, if they're needed for patient care, and that was always an issue. If a company came and picked up a certain lot of records, they were going to microfilm them, inevitably the next day that one of those patients is going to be coming in the emergency room and somebody's going to call for that record or information from that record. So we always had to have a way of getting those records back or having someone get us that information if it was needed for patient care. And also, when the paper records are going to be destroyed after they're microfilmed, how are they going to be destroyed? So all of it has to be spelled out completely in a written legal agreement before the fact, before the records ever go away to be microfilmed. Now, I said that they could be done within the facility. I've worked at facilities where we had our own equipment, and health information employees were hired to microfilm records. That's what they did. Other times, the agency would be outside and come get the records in a big old truck and take them and microfilm them off site. And then I've even worked at a facility where we contracted with an outside company, but we provided them space within the hospital, and so our records never had to leave. They came in and brought their own equipment and set up and did the microfilming in-house, even though they were an outside company. And remember, if this happens, these are known as, through HIPAA, as business associates, and you have to have those agreements in regard to confidentiality of records. Now, when we're developing a record retention policy, we have to think that in most malpractice actions, a healthcare facility or provider has to show that the care provided was consistent with accepted medical practice and was reasonable under the circumstances. That's always the prime objective in a lawsuit. We did what other professionals would have done under these same circumstances. And what that is considered, it's called the standard of care. Did you meet the standard of care? And when I say you, I mean whoever's being sued, whether it's the hospital. And usually in a malpractice case, they're going to sue everybody that ever looked at the patient. But a lot of times it will be against a physician and or the facility. But what the main thing is to prove that the care provided met the standard of care, so that if this care was given somewhere else, they would have done the same thing under the same circumstances. So you need to know that definition, standard of care. So medical records are essential to the defense of these actions. And if there is a malpractice suit, we're going to get a subpoena for those records and send those records to court. And their function is to defend the actions. So when I say defend the hospital or the healthcare provider, but also these are the patient's records. So they will prove in regard to whether what the patient says is true or not. So they're proof or defense of an action. Now let's give an example. This is a really good example, and it is in your book. A Florida court ruled that a hospital could be sued for not making and maintaining a patient's medical records because there's a law on the books that imposes a duty to make, maintain, and furnish copies of the record to a patient and or his or her representative upon request. So what's that say? Florida has a law on the books. It says there has to be a record on everybody, every patient, and they have to be maintained, and if the patient or the patient's representatives ask to see the records or have a copy of the records, that has to be furnished. So that's what the law says. There was a woman and her husband died during the administration of anesthesia before surgery. And so the woman sued the hospital for negligence or malpractice, basically. But she couldn't present a case, or her lawyers couldn't, to establish that there was actual malpractice because the anesthesiology reports were missing from her husband's record. Nobody could find them. They were lost. And so in this particular case, it fell back on the law, not in regard to malpractice, but that the hospital was bound to keep records by law, maintain them, and give her, or it should be her husband, but she was his legal representative after he passed away, to give copies or have access to those records, and they couldn't do that. So instead of her being able to prove a malpractice suit, she turned around and sued them for negligence in regard to breaching its responsibility to maintain and supply medical records. They didn't do that, and so she won that lawsuit. She started out as a malpractice suit, but ended up as a lawsuit for negligence of not following the law in regard to keeping medical records and supplying the information to the patient. Now, after we've kept records as long as we're going to keep them, or we've put them on microfilm or computerized them, we have to destroy them. And when I say destroy, I kind of keep referring to paper records, but if we destroyed microfilm or computerized records, there are certain ways that we're supposed to do that. Upon expiration of the medical record retention period, so whatever the policy is at our hospital or our facility that says maybe after 10 years a medical record will be destroyed, or after that record has been transferred to microfilm and that paper record is going to be destroyed, then we need to have the policies on the book that say how we're going to do it and when we're going to do it. And in some states, there are laws that actually say how we have to destroy records. They give you another example, Tennessee law, that it has to be done in the ordinary course of business and no record shall be destroyed on an individual basis. Now, that's very important, and even if the law wasn't on the book, we should never do this. If we have a retention period, let's say, of 10 years, and we're going to destroy records, but we pull out one record and destroy it after 6 years. If we've met the law of 5 years, say that's the law in our state, and you think to yourself, well, that's okay because we've done what the law said, but it looks awfully suspicious to take one record out of sequence and take that record off and destroy it, especially if that record has to do with any type of lawsuit or anything like that. And so we need to have policies and procedures that say exactly how we do it, and that's what they're talking about, just done in the ordinary course of business. And we'll hear that term many times in regard to medical records. The ordinary course of business, just this is how we ordinarily do things. We destroy records after 10 years. We burn them. We supervise that burning. We have it certified that the records have been destroyed, those types of things. And so that's why it's so important, even if that's not a law on the books, but sometimes in some states it says it has to be done in the ordinary course of business, and no record shall be destroyed on an individual basis. Now, when healthcare facilities destroy records, as I said a minute ago, you need policies and procedures on how and when this is going to be done, and to ensure that records are destroyed completely, that nobody can go dumpster diving. And destruction of a record is not just tearing it in 4 pieces and throwing it in the garbage can. Destruction usually means it is destroyed and no information is identifiable to a particular patient. There will be certain employees that are responsible for the destruction, and after those records are destroyed, they should certify in writing that the records have been completely destroyed, and then this certification is kept on file. And that means that even in your facility, if there are particular individuals that are responsible for destroying records, it could be through incineration, it could be through shredding, but that those employees, for example, let's say that records are incinerated, the employees that are responsible for this will take those records and keep them secure till they get to the incineration site, make sure they're all burned, and stay there till they are. They don't just dump them in and assume that everything's going to be fine. They have to certify that those records have indeed been completely destroyed. And again, the certification should be kept permanently for proof of destruction of the records. Now, AHIMA does have a recommendation in regard to destruction. The appropriate method of destroying health information will depend on the medium in which it was created. Was it paper or plastic, basically? So that's what the medium is. HEMA recommends that if it's microfilm, it needs to be pulverized and then recycled. If it's on magnetic disc of any kind, it can be what we've talked about before, degaussed, meaning erase, unmagnetized, and the data goes away. And if it's laser disc, the laser disc can be pulverized, so completely destroyed, so that that data cannot be accessed. And some states will have actual laws to say that medical records must be shredded, and then the shredded paper can then be recycled. Others say that incineration is okay. And so that's information on requirements of who says what has to be in the record, what has to be in the record, how long we have to keep them, and how we get rid of them when their use is over.